3 months. You have to spend 2 to 3 months exclusively studying for the exam. Prometric exam center is such that it's not that only DHA or MOH exam is happening. There are other exams taking place. So you will basically see people from, you are in a lot of stress. You're really stressed because you have a timer there. Dental Gulf Prometric and Prometric.
So doctor, can you recommend any study materials or resources which will help one to practice or the DHA exams?
There are many training centers. You can just randomly check on Google. So many training centers are there and you can enroll with them. They'll provide you all the study materials. I would suggest two coaching or training centers which has helped me a lot. That is Dental Gulf Prometric and Prometric MCQ. Okay, Dental Gulf Prometric I would say is the best. They have all the study materials, everything. But eventually the thing is they'll give you an overview of how the exam will look. Preparation is on you. They are not going to spoon feed you. They are not going to sit with you and teach you this. So these are the questions expected because they also don't know. Exam pattern keeps changing every year, to be very honest, and you never know. It's all on them, how they want to change it, how they want to change, give a different format. Everything is on them. So they will give you an overview of how the exam looks and some questions related. And then the preparation is on you. You have to rely on yourself on this matter.
Purchases online or how do you get it?
Yeah, online you can contact them. They'll give you all the materials, all the study materials via email, or we had a group in Telegram. So once you subscribe, you will be added to a group which they have in Telegram, and you can discuss with people who are preparing along with you. I mean, I didn't have to discuss with anybody much. I prepared it on my own. And once you get an idea of how the exam looks, once you get an idea of how it is going to be, I think it's easy to prepare. But you have to dedicate some time, to clear the exam.
What are some of the common mistakes or pitfall one should avoid during the DHA exams?
Okay, this is basically a lot to do with yourself. You have to master your mind to manage time. That's all. Nothing else can be done. You have to be very good at time management. First of all, you are in a lot of stress. You're really stressed because you have a timer there. There's nobody going to come and tell you start, stop at this hour, nothing like that. You have a timer, clock is ticking, clock is just going. So you have to be really cautious each time you solve a question. If you don't know one question, it's okay, not a problem. Move to the next one. Not necessary you don't know the answer of second question. Same with third, fourth, fifth. You have to just keep going. Once you're done, you can come back to questions that you were unsure. So that's okay, but time management is very important, and stress management is also very important. It is one thing where you will be really stressed because you are with people you don't even know. It's a different atmosphere. It is not like our MDS or BDS exam where we see familiar faces. Here we are seeing, and Prometric exam center is such that it's not that only DHA or MOH exam is happening. There are other exams taking place. So you will basically see people from different field with you. You will not see any familiar person or people with you. It's all different people. So it's just about time management. You have to learn how to manage time and and not to be stressed.
Sheza, you mentioned about the Prometric test.
Yeah.
So what exactly is Prometric?
Prometric test is basically these exams are conducted by US testing agency. That's what Prometric is. They are basically taking up these eligibility exams for healthcare professionals to practice in UAE, Kuwait, Bahrain. So it's basically conducted by them and the name is Prometric.
So they're the agencies? Huh?
They are the agencies. They are the ones who prepare these questions. They are the ones who evaluate you. And
Sheza, do we have to clear any practical exams?
Okay, now you don't have practical exam. Before they used to have practical exam as well, but now you don't have practical exam because your questions are designed in such a manner that 90% of the questions are practical oriented and only 10% is theory based. As I said, they are not really looking at your theory knowledge. I mean, basics you must know, but it's all about your practical knowledge, how you implement that in your practice. So most of the questions are practical oriented, and this is more than enough for them to know whether you are good with your practice or not. If you can clear the exam, it is obvious that you are good with your practicals.
So do you think practical experience will be helpful?
Very much. You have to have practical experience. If you have not had clinical practice last 3 or 4 years, then it's really hard to clear the exam. In the sense, it's all about how you are going to handle a case. Each time you see a patient, how are you going to handle? What treatment plan are you going to come up with? How are you going to diagnose? And do you even know if treatment needs to be done or treatment should not be done? So that is how it is. So your practical experience is very important.
And Sheza, is there any limit for the number of attempts?
Yeah, you have 3 attempts, and I feel if you cannot get through in first attempt, I would advise everybody to get through in first attempt itself, because it's an expensive exam. You don't have to waste your money unnecessarily. So prepare for it and try to pass. But it's okay. In case you could not clear, don't be disheartened. Try second time, try third time, you will clear for sure. At least first time, if you have not had a proper coaching or training center, with first attempt you know what sort of questions they are going to ask. Accordingly, you will tilt your preparation. Maybe in the beginning you were just referring to dental pulse or dental deck or normal basic perio textbooks or endo textbooks. But after taking up the exam, at least you have an idea how this is going to look like, and you can change your preparation accordingly. Second or third attempt, you should be able to clear.
So Sheza, many of the dentists, they'll have to balance their clinical life and the personal life. So in this busy schedule, how do you think one can manage time or find time to practice their MOH exams or DHA exams?
See, you will have to dedicate some time to clear the exam. You have to spend, I would say, 2 to 3 months. You have to spend 2 to 3 months exclusively studying for the exam. You have to keep certain things aside and focus, otherwise it becomes really hard to clear. Like when I took up the exam, I had some break in between before I joined Apollo and after I left Partha. There was a gap in between, 3 months gap. So that's when I took up the exam, and I dedicated myself only to studying for the exam. I didn't do anything else. So that's also one reason it became easy for me to clear the exam in first shot itself. So it's also a lot to do with your dedication. It's also a lot to do with your focus. So that's very important. If you are going to be in clinical, if you're going to be practicing sometime, then coming back home and studying, I don't think that is going to work, because it's very hard. You're shifting your mind in 2 angles. It's very hard. So everything you have to keep aside and focus only on passing the exams. Then it's easy to pass, is what my belief is.
So Sheza, are there any exam centers in India?
Exam centers are there. India throughout you will find exam centers. In Bangalore, I think there are 3 exam centers, 2 in Whitefield and 1 in Jayanagar. So the moment you book for the exam, you will be given 3 options. Okay, whichever center is close to your residence, accordingly you can choose. Like for me, Whitefield was the closest. I chose Prestige Shanti Niketan. I was very close to my house. So yeah, I took up my exam there. Like in Dubai, I feel pedo has a lot of scope. Range, again, what I have heard is that now they are paying you on commission. See, people like luxury, visual treat. What is good to your eyes, what is pleasant to your eyes is pleasant to your mind. It gives peace to your mind. That's how people are. People like things that look good. So you have to become best friends with Indeed and LinkedIn. That's the only way you can find.